UK Prime Minister Boris Johnson has said that over 1 million people have already been vaccinated in the country. The announcement comes as England goes under lockdown to stem the spread of the mutant coronavirus. Johnson said that over 1.3 million people have been vaccinated after the UK became the world's first country to approve the Pfizer and AstraZeneca jabs.
I can tell you this afternoon, with Pfizer and AstraZeneca combined, as of this afternoon, we've now vaccinated over 1.1 million people in England and over 1.3 million across the UK. That means that nearly 1 in 4 of the most vulnerable groups will have in 2 to 3 weeks, all of them.
Been imposed on England amid the rising number of cases. Schools and non-essential businesses have been ordered shut, while offices are being advised to continue work from home. The UK has recorded its highest daily number of daily infections. The country reported over 60,000 in a day for the first time since the pandemic began. With over 75,000 deaths, Britain is one of Europe's worst hit country by the virus.
Everybody looks at the position. People understand overwhelmingly that we have no choice. When the Office of National Statistics is telling us that more than 2% of the population is now infected, that's over 1 million people in England. And when today we've reported another 60,000 new cases.
The Palace of Westminster, home to the British Parliament, will open its doors as members of the Parliament reconvene to put the lockdown announced on Monday by the Prime Minister into law. Schools, along with bars, restaurants, gyms, theatres, most shops will also remain closed for at least 6 weeks. Earlier, the Finance Minister, Rishi Sunak, had announced a new package of business grants worth £4.6 billion to help keep people in jobs and firms afloat until the measures are relaxed gradually. In England alone, some 27,000 people are in hospital with COVID-19, 40% more than during the first peak in April, with infection numbers expected to rise further after increased socializing during the Christmas period. And our correspondent, Ollie Barat, is now joining us live from London. Hi, Ollie. Give us a better sense of the measures that are being put in place across the UK with this lockdown and to stem the spread of this new coronavirus variant. What are the experts saying about the transmissibility at this point?
Well, to be clear, the new lockdown that is being debated by MPs in Westminster today, many of them remotely, most MPs are not going to be in the Parliament today for this debate. They are joining via video link, the vast majority of them, but it's a lockdown for England, not the UK. Now, the whole of the UK is effectively in some form of lockdown, but the individual nations of the United Kingdom, England, Scotland, Wales and Northern Ireland, have slightly different rules and regulations in place. Here in England, schools have been closed, primary and secondary schools, that is. Hospitality is shut all across the country now, apart from for takeaway services. There is no amateur team sport taking place at all. Leisure centres and facilities that are outdoors and indoors are having to close too, if indeed they weren't already closed, because much of the country was already in the toughest tier 4 of restrictions, but now the whole of England together has moved into this latest national lockdown. In terms of the transmissibility of the new variant of the virus, scientists are still saying they believe it to be as much as between 50 and 70% more transmissible than previous variants, and that is why this new lockdown has been instituted by the government. Scientists are also saying they are not 100% sure that this new lockdown will even be able to get on top of the new variant, that they insist the only way that it can is if the public follow all the rules and the regulations very specifically.
Right, Ollie, the emergency facilities that were put in place during the first wave have been reactivated, but the other concern is when it comes to the shortage of staff. an acute shortage of nurses to help out with the patient's treatment. What more do we know about the government's measures to try and have more people help on that front?
Certainly the NHS is surging its capacity. We haven't yet got to the point throughout this whole pandemic where the National Health Service has been what you would describe as overwhelmed in its entirety. There have been obviously isolated incidents where individual health trusts and hospitals have been struggling to cope, but as yet that surge in capacity has been able to keep things just about under control. What officials are really worried about is that in the coming 2 or 3 weeks we may move past the point of no return in that regard, and that is another reason why this latest lockdown has been instituted. Those Nightingale temporary hospitals that sprung up right at the beginning of the crisis are being readied for action, if not brought into action already. But you're quite right that there is an issue of staffing here, and part of that is to do with the fact that so many staff in the NHS at the moment are currently off sick themselves with COVID-19.
Right, we're leaving it there for the moment. Ollie, thanks very much for joining us with those details and perspectives. WION now available in your country. Download the app now. Get all the news on the move.